Hello, everyone. This is Wenjia. I'm truly glad to be here. Today, I'd like to talk to you a seemingly huge topic, the human cost of climate change, which is actually closely related to each and every one of us. Look at this beautiful stripe. It is neither a rainbow nor a ribbon. It actually represented the number of global heat-related mortality aged 65 years old and above since year 2000. And in year 2023, actually, the number has reached to 415,000. And the redder the color is, the higher the number is. And you can also see the annual average growth rate on attributed deaths in the past 20 years already reached up to 2.3%. And in comparison, the rate for air pollution-related deaths only increased by 0.07% per year. So with that said, the heat-related mortality increased with a really rapid rate. And you may ask, do these people die directly from heat stroke? No, not all of them. Actually, around the world, the people that dying from the heat stroke is relatively small. And most of the people dying from this figure is because of the acute onset of their diseases induced by high temperatures. For example, high temperatures can lead to excessive sweating, an increase in flood infiltration, and plasma viscosity, which exacerbates the risk of cardiovascular events. Similarly, high temperature can also lead to those onset of respiratory and also kidney diseases and increase the risk of death. But you may wonder, well, we seldomly hear it from our doctors, right? When you go to the hospitals, the doctors usually show you the name of some diseases as shown on the screen. But the real causes of our death is actually the risk factors on the right side of the figure, which are smoking, diet, and also non-optimal temperature, or we talk about the thing we talked about, climate change. So as early as 2,000 years ago, 黄帝内经, or the Yellow Emperor's classic of internal medicine pointed out that the inferior doctors treat diseases after they have already developed, but those superior ones prevent diseases before they occur. And that is why we should really pay more attention to those risk factors behind those diseases. And you can see from this figure, the non-optimal temperature already ranked 10th in the top 10 risk factors in the world in 2021. And in China, the rank could be as high as 8th, even higher than high BMI or overweight. And that is why we should really pay attention to that. And I once visited northwest part of China for a field trip. And there, I talked to public health professionals. And I talked about the high temperature of climate change and how that would impact our health. And he replied me with a polite smile in his face. And he said, well, Professor Cai, it's very cool here. The highest temperature in summer rarely exceeds 28 degrees Celsius. And the heat wave problems you just talked about doesn't exist here. And this is actually something that terrifies me, because climate change is actually driving the spatial distribution change in all around China. And that is something I will talk about in the later slides. And not only about non-optimal temperature, you can see that climate change is actually fueling the fire behind many extreme weather events, such as heavy rainfall, flooding, typhoon, drought, and wildfire. And all of these kind of extreme weather events, they all lead to different kinds of diseases, such as waterborne diseases, such as trauma and other mental health problems, such as malnutrition, such as cardiovascular diseases and respiratory diseases. So when I talk to these public health professionals, and his reaction is really making me nervous, because he didn't notice that the spatial pattern of those heat-related deaths is changing. As we can see from this figure, these heat-related deaths, heat wave-related deaths, is actually moving from those coastal and southern part of China into the inland and north part of China. And these areas are actually the least prepared ones, not only in terms of their awareness, but also in terms of their infrastructure. Let me tell you one number. In 2023, the air conditioner ownership rate in China as a whole nation already reached up to 134 units per 100 households. But let's take Xinjiang, for example. It's also located in northwest part of China. And the air conditioner ownership rate was only 22. So these people will be hit the hardest when heat extreme comes. And this is one part of the aspiring, the terrifying parts. And the second one is that climate change is making those record disasters normal. As we can see from this figure, this is a graph from the 2024 China Lancet Countdown Report on Health and Climate Change. And we can see that out of the 9 indicators implies the health risk from climate change, 3 of them have already reached up to its historical highs. And the rest of 3, as we can show on this, this pink color, already reached to the second highest in history. But I don't know whether you have elderly people like my grandmother around you. My grandmother is already 85 years old. And she knows it's extremely hot outside, but she insists on walking for 8,000 steps at the same time slot in the day. And the reasons are simple. Just look at this little fish tank. No matter how much exercise you give to this little fish and how good the food quality you gave to this little fish, if you forgot to change the water, the health of this little fish won't be good. So the same reason goes for people. Exercising in a harmful environment usually brings more health risks rather than benefits. But you would say, well, the numbers you just talked about are only for those elderly people. I am a 20-year-old young man or young woman. I don't feel vulnerable or even affected. Indeed, all these vulnerable peoples that are mentioned by literatures are those people who are elderly people, who are pregnant women, who are children, people with pre-existing health issues, and with outdoor workers. But we usually neglect the wider group. So let's do a quick pause here. How many of you love doing outdoor exercise? You can simply raise up your hand. Quite a lot, right? And we all know that doing physical exercise is good for your physical and mental health. But climate change is changing the summer in Guangzhou, hotter and more humid. And we have carefully examined the temperature and humidity composite index in the summer of Guangzhou, and we have selected the 5th day of each month out of the whole year. And you can see from the screen, in year 2000, in months like May, June, and September, you can still find some time slots marked by the green color, which are suitable for doing outdoor exercise. But in July and August, you will find less luck, because most of the time slots during that day is marked by dangerous or extremely severe warning to do outdoor exercise. And if we look at the results for year 2021, you will see from the period from May to September, you can hardly find any time slots that are suitable for doing outdoor exercise. So what does it mean? It actually means that with a warmer and warmer climate, you will have more and more difficulty to finding suitable time to do outdoor exercise. And my second question to you is, how many of you have an insomnia problem, which means you have difficulties falling asleep or staying asleep? Please raise up your hand. Some of you, okay? And study shows that the sleep hours lost due to high temperature actually increased quite a bit in the past 30 years. And in year 2023, it has already reached up to a new record high, over 6% compared to the past. So the low latitude regions, they actually lost more, about 200 minutes to 400 minutes per person per year. And in some areas, this number could reach up to 600 minutes. So with a warmer and warmer climate, I really suspect that more people will suffer from this insomnia problem. And my third question to you is, how many of you have a pollen allergy issue? Please raise up your hand. And the report shows that in the world, 10 to 30% of the population is now suffering from those pollen-induced respiratory allergies, and the number is still rising. But what is climate change doing? Climate change is leading to an earlier flowering time and a longer flowering period, and an increase in the pollen concentration. So for the normal people, we're certainly glad to see more plants and beautiful flowers around us. But for those people with pollen allergies, it's certainly not good news, right? So the next figure actually shows that the climate change can even hit the fittest of all. You see from this figure, they are the photos of those top marathon runners. And this result actually shows for those marathon runners who are eager to improve their own performance, their efforts will be mostly wasted under a warming climate. And to do a marathon running under extreme weather events, sometimes it would be deadly, like the events happened in Beiying in China in 2021. So I have to say, well, no one is immune to the health threats of climate change. This sounds like a sad news, right? But the other side of the story is the health impacts from climate change are preventable. So for individuals, let's say what we can do. By attending talks like this and knowing whether you have climate-sensitive disease and understanding that whether your disease is sensitive to heat waves, cold spells, heavy rainfalls, or wildfire, you could easily find ways to reduce the exposure of yourself to those dangerous environments. If you don't know which diseases are easily to be induced by the upcoming weather, you can keep an eye on the climate health warning issued by your own local governments. Additionally, it's very important to know how to help others, especially when extreme weather happens. Pay a visit to the elderly people and the other vulnerable groups around you and see if they need any help. For example, buying something, the grocery or medicine from outside. And you can easily help them. And also, please also actively participate in the community voluntary services. And for local governments, it's necessary to agree on a lead body and to clarify about the responsibilities of other coordinating departments. And second, it's also important to plan well with a real-time surveillance and timely warning system. Instead of telling people simply, don't go out, you can tell them, well, over the whole day, which are the appropriate time slots for you to go outside for exercise or for grocery shopping. You can also tell family doctors to pay more visits and give more advice to those vulnerable groups when extreme weather happens, such as reminding them to turn on fans or air conditioners when hot weather arrives. You can also make more accurate pollen concentration forecasts so that people with allergies can take preventive medicines before they feel any symptoms. And for enterprises, new challenges always come along with new markets and new opportunities. So with the improvement of living standards and the rise of awareness, people would have more needs for those customized early warning services. For example, if I am a people who have kidney diseases, how can I regulate my water intake when high temperature weather arrives? Based on these specific physical conditions, people would also need advice on where to engage in what kind of activities when the weather is kind of extreme. So meanwhile, for workers who cannot avoid the exposure to extreme weather events, such as firefighters, doctors in protective suits, construction workers, farmers, and deliverymen, they also need to wear cooling vests as shown on this figure, and possibly wear wearable diseases that can monitor the local environment in real time and give them really customized and personal suggestions how to protect themselves. In urban design and retrofit, many new technologies and new equipments will also be needed to be installed in order to reduce exposure to those extreme weather events and to increase climate resilience. So in short, there is a huge market to be explored. And last but not least, the most important and fundamental measure is to reduce our carbon footprint. Controlling the magnitude of climate change is equal to preventing the disease from happening. So nowadays, half of the high temperature days is caused by climate change. So if we can achieve carbon neutrality or even climate neutrality, we can easily prevent all these unnecessary deaths. So for a healthy and low carbon journey ahead, I hope we can fight together. Thank you very much.